member from Oshawa.
Thank you, Mr. Speaker, and my question is to the Acting Premier. Today, frontline mental health workers from OPSU will be here to call for government action to keep people safe on the job. Workers in the mental health sector are put at risk every day. Hundreds of physical assaults against staff are being reported every year, and that is not okay. Every frontline mental health worker needs to be able to go home safely to their families at the end of their shift. Workers need to know, when will this Liberal government step up and take real steps to prevent violence against workers and patients in the mental health sector?
Thank you.
Minister of Labour.
Minister of Labour.
Thank you, Speaker, and thank you to the member for that excellent question. And it's a very important question because we take incidents of workplace violence and workplace harassment very, very seriously, Speaker. And the nurses and the employees that work in our mental health facilities, Speaker, they provide the highest quality of care for Ontarians, and we're committed to, while they are providing that care, Speaker, we're committed to ensuring that they work in safe conditions. Now, to help with this goal very specifically, the Minister of Health and Long-Term Care and I announced a leadership table some time ago, Speaker, the Workplace Violence in Healthcare Roundtable. It's comprised of key stakeholders, including those people that do such a wonderful job in the mental health facilities. It includes patient advocates. What they're doing, Speaker, is they're looking at the root causes of violence against healthcare workers. And where we began very, very specifically, Speaker, is with the nurses in those facilities. Speaker, the union OPSU sits at that leadership table. I know they've expressed recently how successful this program has been and how they plan to remain committed to it, Speaker. I look forward to adding more in the supplementary.
Supplementary.
Thank you, Speaker. Again to the Acting Premier. Frontline mental health workers have reached a tipping point. They cannot carry on facing hundreds of assaults and incidents of workplace violence against staff day after day, every year. The people who work so incredibly hard to provide mental health care need to see real action from this government to protect them on the job. They deserve answers today. Will the government's leadership table on workplace violence prevention consider each and every recommendation from frontline mental health workers, those who do the job, and provide a funding package to pay for the implementation of these health and safety initiatives?
Thank you. Minister.
Thank you, Speaker. Thank you once again to the honourable member. Speaker, OPSU sits at the leadership table. They're right there. They are not afraid to express their opinions. Believe me, Speaker, I've been at some of the meetings, and they've expressed recently how successful they think the process has been today, Speaker. Both the Ministry of Health, my ministry, the Ministry of Labour, have been working with OPSU to make these facilities as safe as possible. We remain committed to that goal, Speaker. The process is going well. Based on the advice of the table, whatever the recommendations are that the table comes up with, Speaker, we're going to develop a plan to make hospitals safer, mental health facilities safer. Speaker, I have offered to visit Waypoint myself. I will be quite happy to go up there, speak with the folks. I'm awaiting the invitation to be accepted, Speaker, but certainly we're committed to making sure that those people that do such a wonderful job for us work in safe working conditions, Speaker. Thank you.
Thank you.